Hello. Thank you so much for doing this procedure for us, this sampling of this new type of cream medication for the face. We really do appreciate any type of volunteers that will do this for us. So of course you know that what this is. You've been trying our product for 1 week. Okay. So what I'm going to be doing is testing out areas of your face, taking skin samples, checking your eyes, checking everywhere that might be affected by the cream, just to make sure everything seems fine and normal. Has the cream helped you with your skin issue that you did have? Okay, good. So it is doing what it's supposed to. Okay. And you did say you've been doing it for 1 week? Okay, good. Okay, that's good. Yeah, I don't see any breakouts or anything. I saw the photographs before you started taking it, and your skin does look like it's cleared up considerably. That's great. That's what we like to see. But of course, we do want to make sure there's no adverse effects, and of course, there was not going to be any type of major adverse effects, but we need to make sure there's absolutely no adverse effects related to your skin. Anything around your eyes, no puffiness, nothing like that, nothing around your nose or mouth or anything like that, okay? Alright, so I'm just going to ask you just a few questions, and then we'll get started with me checking your face, okay? Alright, so first thing, did you have any type of itching or redness when you first started using the product? No? Okay, good. While using the product, did you go out in the sunlight quite a bit since it's summertime? You did? Okay. Did you have any, were you more sensitive to the sunlight? Would you get sunburns easier or anything like that? No? Good. Alright. As you were using the product, was there anything about your skin that changed as far as it being more sensitive to maybe if you scratched your face or something like that, like the skin seemed thinner, like it might break easier, like maybe if you scratched your face, all of a sudden it might start bleeding a little bit or anything like that? And you said you get your eyebrows done. Okay. When you got your eyebrows waxed, when they waxed them, was there any issue with that? Like it was very sensitive? No? Okay, that's great. Okay. Sometimes, you know, skincare medications can make the skin extremely sensitive to other things, but that's great that it didn't to you. Okay, let's see. You said you've been doing it 1 week. When did you first start noticing a change in your skin, like it was starting to clear up? After the 3rd day? Okay. Did you have any thing related to a change in appetite? Were you more hungry? You were a little bit more thirsty? Okay. All right. Do you have dry mouth? Okay. Do you still have dry mouth? Okay, I'll look into that. Okay. What about your nose? Are you nose running? Nothing like that? No. Okay. Are they itching? No, they don't look red at all. Okay, but they're not itching. Okay. Well, what I'm going to do is, again, I'm just going to be taking a sample of different areas of your face, looking at different parts closely to make sure I don't see any adverse effects from the medication. Did you already take your dose this morning? Okay. So you're taking another one tonight at 8. All right. Okay, so give me just a minute. I'm going to get my gloves on, and then I will start checking your face, okay? Okay. So the first thing I'm going to do is just take a regular pen line and start looking closely at your face. I'm going to start with your forehead. What I'm looking for is any type of dryness or redness or irritation. This one spot. And you said that you haven't felt any type of itching or anything, so that's good. And no irritation. Go ahead and put your chin up for me. No irritation due to sunlight, so that's good considering your skin is sensitive anyway to sunlight. We don't want to make it any more sensitive than it is. Go ahead and turn your head that way. Okay. Oh, you're doing great. I'm so glad it's been working well for you. We have had 3 other people tested, and out of the 3, one had one adverse effect, and all it was there was a small dry patch on their face, and we're not even sure if that was even caused from the medicine. Okay, go ahead and dip your head down for me. I'm also looking up close to your scalp because sometimes it can have an adverse reaction to the scalp. It can make it a little bit dry. Because you know, the skin on our face and scalp is much different than the skin on the rest of our body. Oh, but that's another question I have for you. Did you notice any changes in the skin on the rest of your body? Did you have any type of rashes or anything like that? No? Okay. Good. And that includes anything in your private areas? No? Okay, now what I'm going to be doing is taking this UV light. I'm going to be putting it close against your skin. That way I can see anything on your skin that I can't see with just looking at with a naked eye. It'll pull up anything like, any type of sunspots or anything that looks a little bit abnormal. And it'll also pull up anything like some type of abnormal sebum, which your skin produces normally in your pores, but it will pull up anything that looks a little bit off related to that. I know what looks normal and what doesn't, so this light is going to help me with that. It's not going to hurt, burn, anything like that. So just look straight ahead at me, okay? Good. Just going to be going down lightly. Actually, let me dim the lights just a little bit, okay? There we go. Yeah. Just be looking lightly at anything. See if I see anything on your face, your forehead. Okay, there's a spot right here. Let me look at something real quick, okay? Oh, okay. That's nothing to be concerned about. sometimes the light will pick up stuff that's not really anything, but we have to be careful and check. Okay, go ahead and beat your neck up for me. Good. Go look down your neck. I'm going to be pulling on your skin just a little bit too. Okay, look straight ahead at me. I'm going to be touching your nose. Kind of pushing it to one side. Okay, and the other side. Okay, very good. Okay, so I didn't see anything there. So give me just a second. I am going to move on to checking your eyes, nose, and mouth, okay? Okay, so I'm going to just get you to do a quick eye test for me. I'm going to use this and cover one eye. I'm going to cover your left eye. Alright, read the lowest line you can read for me. Good. Alright. Covering your right eye. Read. There you go. Read the lowest line you can read for me. Good. That's excellent. Okay. And you don't have contacts or anything like that. Go ahead and just look closely in each eye. What I'm looking for is any type of eye irritation around the whites of your eye. That is the only area that may have eye irritation from the medication, okay? The only reason we're checking the eye side is that's routine, okay? There has been no studies showing that this medication affects that, but it can affect the whites of your eyes. You may have more redness or something like that, and we are just making sure that there is nothing like that. I'm going to go ahead and pull your lid down. I want you to look up for me. Up, 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 up. Good. Right, I'm going to pull your lid up. I want you to look down for me. Good. Look to your left. And to your right. Good. Alright. Other eye. Look straight ahead for me. Alright. I'm not seeing any irritation there. I'm going to put your lid down. I want you to look up for me. And I'm going to put your lid up. I want you to look down. Okay, to your left. Very good. To your right. No, keep looking right. Keep looking right for me. Okay, alright, very good. Okay, now the next part, I'm going to be checking down up your nose and down your throat. I'm going to start with your throat. Put this attachment on here. You haven't had any type of sore throat or anything like that, right? Just go ahead and say, ah, and stick out your tongue for me. Good. Just going back, 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 back. I know you may not feel some type of irritation. I promise I'm not going to touch the back of your throat, so you're not going to have a gag reflex. Okay. I don't see any redness. I see you still have your tonsils, so they look fine as well. Good. Alright, go ahead and close your mouth. You haven't had any dry mouth. Well, no, you did say you had some dry mouth, right? Okay. You hadn't had any trouble swallowing, though. Alright, open your mouth again for me. And don't stick out your tongue. part. Would you look up for me? I'm not going to stick it very far up, I promise. I am just going to look in. I'm going to press your nostril up. Good. Hold still for me. I am just looking for any type of irritation, redness. You haven't had any type of bloody nose, or if you blow your nose, there hasn't been blood in your mucus, correct? Good. Very good. And other side. I'm going to hold your nostril up. Going up in the nose. Very good. No irritation. Great. Well, it looks like you have received all the benefits of the medication without having any side effects other than a little bit of dry mouth. Which, like I said, of all 4 of you that I've examined, only you and the other 2, that was really the only issue. 1 person actually didn't have any issues. 2 of you had dry mouth, and the other person had like a little bit of a skin issue. But again, we're not sure that's even from the medication. Let's see. Give me just a second. Okay. So, just going through, marking everything. And because you have volunteered and everything is good with your, with everything with you, you will continue to use the medication. This is a month-long treatment. After a month, you should be good as far as your pores opening up and keeping, you know, sebum from getting clogged, which causes, you know, pimples and irritation. That should be cleared up for a very long time, and by very long time, I mean at least a couple of years. And, of course, that's a really good thing, considering you only have to take it for a month and without any side effects of the dry mouth. So you are good to go. Go ahead and continue to take it. I know you have a month-long supply. Once you've finished with a month, you should be fine. Of course, let us know if there's any type of issue before then, and you can immediately come back in and we'll check you. Although we have 2 of the other patients have been taking it. One of them is about to be finished in a day, I think, with their month supply. The other one will be finished next week. They haven't had any more issues. So just continue to take it, and it should help you clear your face. And we're really hoping we can get this on the market because it's a really helpful medication for skincare. Okay, all right. So it's good to see you. Just let us know if you do have any more issues, okay?